Maroochydore has a call. Thank you for all the assistance.
Thank you very much. Thank you, Mr Deputy Speaker. The Premier has 30 media spinners, we are told, tucked in her office and other senior ministers' offices, and highly curated media conferences. But that's not accountability and transparency, particularly when the Premier turns on her heel when she's got to go. Accountability and transparency is being willing to answer the questions, table the advice and come back to this parliament, to allow parliamentary committees to ask the questions. This parliament, the Queensland Parliament, is the most gagged parliament in Australia. This is the only parliament where we see standing gags where, unfortunately, there's a list of members who want to speak who may not get to speak because there is a deadline, and if the debate hasn't allowed them to speak by then, this is pushed through. We've seen a parliamentary committee that only had about 1 hour's hearing into this legislation. We have a parliament that has sat the least number of days in all of Australia, 40 days last year. Now, all of Australia was experiencing the challenges of COVID, but no, Queensland was special in this. They didn't want to be accountable to the parliament. This is a unicameral parliament. Of all the parliaments with extraordinary powers that often sit with the executive government, they should go the extra mile to be accountable to the people. And when you're asking so much of people in the name of their safety with a pandemic, you should trust them. They deserve more trust being going their way. The government's asked a lot of the people. It's time to trust them with the information. A pandemic, and certainly COVID, is a serious disease. I know families who've lost loved ones to it. It is not the same as the flu. It is a serious disease. It did need special measures in order to prepare the community, to get people vaccinated, to get our hospitals ready, even though we know our hospital system was struggling before COVID, well before COVID. But more than 90% of the people are now vaccinated, and the Premier had promised that there would be a review, I understand, at 90%. We are still waiting for what that will be. The people deserve the information as to when the pathway out of this, when the restrictions were stopped, where the trigger points are, but the health advice that this is based on. And we will not have this rot where we have government ministers lecturing all those people out there who are actually vaccinated, who are saying we're concerned about the lack of accountability. We're concerned about where this stops. Now, I get it. It's an easy go-to for government ministers to abuse people as saying we're concerned about the checks and balances on power. But there are many people who have got the vaccination who, like myself, I'm triple vax. I believe that we have wonderful scientists who've done an outstanding job. But I also believe in democracy and the right to trust the people with the information. I also believe in checks and balance upon power, and one of those fundamental checks and balances is bringing things back to this parliament, not in 6 months' time without the opportunity of review. So the amendments my colleague, the member from Maroochydore, has put forward in regard to transparency, releasing the health advice, and certainly we would like to see parliamentary committees able to review these matters, but putting a limit on this time is reasonable. And the government doesn't want to face the potential for a recall of parliament because they think that's onerous. Well, they did it with 2 days' notice with Gordon Nuttall, and I'll table advice from Queensland Parliament about that. And there's been other examples where this government has changed the parliamentary sitting dates with only a few weeks' notice, but certainly with Gordon Nuttall, it was with only 2 days' notice. So I table that advice along with the subsequent advice about the change in parliamentary sitting dates for another time when the Premier, as I understand, was going to the Commonwealth Games baton relay and tacked on a trade mission afterwards. So they can do it. Trust the people. Give them the information. They deserve that. I want to pay tribute to Dr John Gerard as our Chief Health Officer, somebody who has the experience of dealing with pandemics, dealing with serious diseases. And I think people, as medical experts, who are willing to go into the face of personal danger themselves, as he did, with teams of other medical experts into Africa with Ebola, and treat the people, is an extraordinary individual, as are many of our health professionals. And I am so grateful for people who are willing to do that. And I do believe it is important that we don't overwhelm our health systems. They are prepared. We encourage people to get vaccinated. I do support the National Health Advice, which is one of the one of the provisions we acknowledged that there was a national health body providing their expertise, advising about why it was important and is important for health professionals, aged care and disability workers to be vaccinated. And when I've explained this to people, say, but it's my freedom not to be vaccinated, I said, in the majority of cases, well, it still is your choice not to be vaccinated. But when it comes to these particular professions, when you're old, when you're vulnerable, when you're disabled, you don't get to choose who treats you in a hospital. And that's why it's important that those professionals under the health advice particularly have to be vaccinated. Now, I do believe there needs to be greater clarity around where exemptions apply and how that works. Where there's been a lot of the controversy has been the extension of that into other areas, certainly into our hospitality areas. And there may be good health advice to have justified that at one point, but once again, we've never seen the full advice. And what's really hurt people is the inconsistency. So where was the health advice that said it was okay for footballers' entourages to come in while there were people losing their babies because they weren't able to get the health care in Queensland? They were stopped at the border, and the tragedy of that happening. And of course, you know, state Labor government, they say, oh, you know, don't look here, don't look there. It happened. They are real stories. One rule for some and a different rule for others. Those inconsistencies were a disgrace. When you had more than 3,000 Queenslanders cut out of coming across the border to go home, and once again inconsistencies where the government was waving through celebrities and people who might fit on their social media accounts but weren't known in the media. Those people who weren't known in the media weren't allowed across. There were avoidable examples if there'd been more compassion and consistency in the way some of these rules have been applied. And that's why we're saying release the health advice. I strongly support my colleague, the member for Mudgeeraba, in the measures that she's put forward. I do condemn this government for gagging this parliament, gagging the opportunity of many members to speak, but also having a position where they don't think it's worth bringing it back before this parliament, except in 6 months' time if it's necessary. That's not good enough. We're asking a lot of the people. The people have an investment in their own health and their community. And we want to see our health systems be able to cope if there is a change and there's another variant that comes through. But we've seen the example. This government recalled this parliament with 2 days' notice when it suited them. They can do it whenever they like, and goodness me, we've seen they waltzed in here and shut down debate on other matters. They gagged the debate. This shouldn't be a plaything of the ruling government and a unicameral parliament. They should go the extra mile, have the scrutiny, trust the people, have measures that you can justify with the health advice, but release that health advice. The people deserve that. And for the sake of all those who've suffered with COVID in their families, some with the tragedy of losing loved ones or having serious disease, and the tragedy of those who suffered some of those inconsistencies when they weren't able to see a loved one in their final moments, or they lost their babies because this government said our hospitals are for Queenslanders, and those poor people across the border were blocked and didn't have a chance to get their babies treated and the mothers treated in a timely way. Let's have compassion, let's have consistency, let's have transparency, and every time this government has to put people onto a go slow to address the many examples of their inconsistencies. You know, there are so many of these examples, and really, by this time, you should have got it right. The government should have got it right, but that's why we're calling to treat the people with compassion, consistency, and release the advice.